It's Dr. Epstein. I have a nice, interesting case. Combination of hairline long surgery to excise a prior transplanted hairline. A young woman had transplants done 3 years ago, done elsewhere, unhappy with the density, the appearance, the naturalness or unnaturalness. She got reasonable scalp laxity, so what I'm going to be able to do is bring down her entire hairline and cut out the area of prior grafting. So her hairline will be naturally lower. It'll be her original hairline brought down. She also had some micropigmentation, which will be removed as well to that area of the transplants. In addition, she's got two prominent bumps, unusual shape to her forehead, worse on the right than the left. I'm going to be doing some rasping of that area as well, all during surgery. So why don't you come in here? Thank you, Marco. So this is, you can see it's dark where the micropigmentation was done, but you can see where her original hairline is. That's the top line. This whole thing is going to be brought forward. I'm going to be able to remove this as much as I can, get all these prior transplants and give her a nice lower hairline. It's going to be a lot fuller, this density, as opposed to this. Also, this is the two red areas where I'm going to be doing some rasping, where I'll be able to smooth out her forehead. Anyway, this is Dr. Epstein. Thank you.